Good evening, everyone. Thank you for joining us this evening for The Real Deal with StudentProCONNECT. StudentProCONNECT is a social networking website and an app where students and industry professionals can connect. If you are a student or someone looking to change your career, you will be able to find valuable insight firsthand from people in the field. If you are an industry professional, this is a great way to give back and share your story to inspire the new generation. The purpose of this segment is to provide the real deal behind what it takes to start and thrive in various fields. Every segment will feature an industry professional telling their story and sharing their insight. If you have not done so already, please sign up on Student Pro Connect by either going to our website, www.studentproconnect.com, or downloading our app, which is available both in Google Play or the App Store. Please feel free to type in your comments and your questions during the show. Now, without further ado, I am very pleased to present our guest for this evening. She is a nurse anesthetist, or CRNA. Her name is Sharifa Lindo. Welcome, Sharifa.
Hi, thank you. Good evening, everyone.
Yes, so let's get right into it. So, what is a certified nurse anesthetist?
So a CRNA, which we usually abbreviate it for, stands for Certified Registered Nurse Anesthetist. We are advanced practice registered nurses. We're responsible for safely administering anesthesia prior to and during medical procedures. We work in different settings as far as hospitals, surgery centers, medical offices, dental clinics, and we're responsible for administering anesthesia to patients during surgical, obstetrical, and trauma care procedures. We also collaborate with doctors and other nurses to develop pain management plans for each one of our patients.
Okay, now are you in the operating room? Is that
yes.
Okay, so you're actually in there doing surgery?
Yes. So while you're having a procedure done, say you come in for gallbladder removal, an appendix removal, any type of procedure that anesthesia is needed, we're able to provide that.
Wow. And now I said that it says here dental clinics as well?
Mm-hmm. So in certain dental clinics, especially pediatrics, and when they won't be able to tolerate sitting still, or they're scared, we can administer nitrous oxide. We can give what we call Versed to kind of ease your anxiety. So usually they require an anesthetist to provide that care and monitor the patient.
Got it. So it's kind of like you're relaxing or kind of numbing the patient during the procedure. Got it. All right. So I guess walk us through it. I mean, you can even share with us kind of the path you take, which we'll talk about a little bit more later on. But how do you get to this point?
So I completed a 4-year bachelor's degree program. And once you do that, you get your registered nurse license. You take your NCLEX, which is the boards, to be able to practice as a registered nurse. Once you complete that, if you're thinking to move forward and want to do CRNA, it is important that you have clinical experience as a nurse in the ICU. So certain programs will require you to do 1 to 2 years minimum of ICU experience before you can apply to a program. So once you apply to the program, you'll notice lately now all programs have pretty much converted over to a doctoral degree program. So that's 3 years in that program. And once you're completed with that, you take your boards again to receive your CRNA license. And then once you're done with that, you're a DNP CRNA.
Wow. Now, do you have to, I guess, in this case, do you have to go for the doctorate?
Yes, you will rarely find programs now in South Florida that do not require your doctoral degree. So now, yes, you'll have CRNAs who went to school and got their master's and pretty much they're grandfathered in. They don't have to get their DNP. But if you're entering the program now, then it's going to be a DNP program.
And you said it's kind of lumped in together. So
yeah,
so from the bachelor's and then you go into this program, it automatically is for you. So master's and doctorate kind of together?
Yes.
And how long is that, did you say?
That's 3 years.
3 years. 3 years. And for the bachelor's, how long? I guess
bachelor's is 4, because that's considered undergrad of college. So 4 years.
Got it. Now, question, could you go for an associate and then go into the master's program?
I don't think you can do that for anesthesia, but I do know you can do associates and then go into a master's program. But as far as it going for CRNA, I'm not sure you can do that for that.
Got it. Okay. So one thing that I when I was kind of researching the field before, our show tonight, it says that there is a lot of growth in this industry. So just a statistic here, it's expected that 17% growth. There's going to be a 17% growth through 2028. I know you're in the field, and especially one thing I want to say, first of all, I mean, I didn't bring it up before, but salary-wise, in all the different nursing specialties, is also at the top. It's number 1. So that's something definitely we should highlight. But what are you seeing in the field? Do you see there's growth? Is it stagnant? What are you seeing?
I feel like there's such an increased growth because I feel like the whole CRNA job, a lot of people even today don't know what is a CRNA?
Yes.
What do you do?
Yes.
They think we're all anesthesiologists, and it's like, no, we have to kind of bring it down and be like, no, we have to explain our role and the difference between the anesthesiologist and CRNA. Not that there is a huge difference. We do the same thing. It's just, the schooling is different and the degree is different. One spent time bedside with patients while the other, is more clinical per se, not really bedside. But as far as growth, there's many things you can do. I mean, some people may specialize only in pain in the sense of, okay, for example, we have a block team. So if you only want to specialize in blocks, like nerve blocks, to help someone through a procedure, like if they're having something done on their hand and they don't want to go through general anesthesia, be put to sleep, what you can do is a nerve block so that they don't feel any pain or anything on that arm while they're having the procedure done. Some people would specialize in only obstetrics. So they'll only do OBGYN, they'll only be doing procedures to help, the epidurals or, be in the operating room for C-sections. So there's a lot of room of choosing what really you like and, just enjoying that.
So I guess a question here I'd have is, when you're a CRNA, is it by specialty? Or are you for all the procedures?
You're able to do everything. Now, depending on where you work, what hospital and what setting, it will kind of defer how independent you are, or if you're doing certain things often. So for example, me going through school, I did everything, because you need to have experience in all fields, because you never know, where you may end up. But currently, for example, I haven't done OB, which is obstetrics, in a while, but if I were to need to do it, I've trained in it, so I can. Got it.
Okay. And then of course, let's talk about the salary.
So I know, like, the salary is a big thing, like with CRNAs. So the salary, yes, you make 6 figures. It does depend how much of a 6-figure range you make, because honestly, it depends on the state. It depends on what hospital. It depends on if you're doing private practice. It depends on a lot. I would say it ranges between like 130s to as high as 200,000, So it depends where you are, what state, what hospital, and what practice you're actually working in.
Okay, got it. And now, do you think I guess it's because you have your doctorate, that's why that's the hike? right? Just having that at that level, that's what makes the salary jump up.
No, the doctorate honestly doesn't change whether you get more or less.
Okay.
It doesn't. It's just
Okay.
more of how do I say it? Evidence-based research. You know, we're big on that in nursing, and you know, increasing patient care and you know, better outcomes. So that's really the D&P part of your degree.
Got it. Got it. Okay, so now let's go to your story, Sharifa's story. So education. So you went to University of Miami, you did your bachelor's in nursing, and then you stayed there and you continued on and did your doctor of nursing practice, and then went on to get your CRNA. So I guess my question here would be, did you always know you wanted to do nursing?
I always wanted to be in the medical field. I did originally want to be a medical doctor. What changed my route was having my first child when I was 18. So I felt like, okay, what can I do to, you know, start making money now, but still enjoying the medical field. And I felt like nursing was the next best thing because I'm more of a people person and I wanted to be able to, you know, communicate more with patients one-on-one. So I felt like that was the next best field for me.
Got it. So once you kind of set your mind on it, once you started the program, it was clear for you that that's what you wanted to do. So you weren't like, once you started, you're like, oh, this is not for me. You stuck to it.
Yeah, I stuck to it. I loved it.
Got it. Now, did you go straight from bachelor's straight into, or did you take a break in between from bachelor's to doctor?
So between my bachelor's and then graduate school, in order to apply to the program, you have to have at least 1 to 2 years in the ICU. So I worked 3 years in the pediatric ICU before applying to UM for their D&P CRNA program.
Got it. So you didn't go so you didn't break in between necessarily and then go back?
No.
Okay, good. So you just went straight. And total, so 7 years? Is that 7?
Yeah.
7 years of schooling. 7 years of schooling.
Yes, 7 years of schooling, yes.
Oh my goodness. Now with the certified, so the certified registered nurse and the anesthetist, that was coupled in? Is that another program to get that certification?
No, it's one program.
Okay.
Yeah, one program.
Okay. And then that's also master's too, right? So you got your master's at that same time.
Yeah, they don't consider it getting your master's. They consider it getting your doctorate because it's either doctorate or master's. Yeah.
Okay. All right. So I guess you graduate and then what happened? So you've been in the field as a CRNA for about 7 months now, but as an RN for 3 years. So walk us through what happens after you graduate.
So after I graduated, I applied to different CRNA position jobs. There's many positions, so there's never a question of, oh my gosh, am I going to get a job coming out of school? You have a job before you come out of school, actually. Wow. But I had a dream job that I prayed about, and I was very grateful and blessed to get it. So I got my dream job, and I'm currently working there now. And it's been a good experience. It's been great. I can't complain at all.
That's amazing. So you actually start getting, you have a job before you graduate. So you started getting offers before? How does that work?
So because during school, we have clinical rotations to different hospital sites. So you get a little taste of what each hospital site is like, what is the flow, what is the environment, what is the culture. So a lot of the times they're looking to hire CRNAs, and you can always, apply for those jobs prior to graduating, and they will hold that position for you. And once you're done and you get certified and you pass your boards, then, you go through the process of credentialing with the hospital and you start working. You even have some hospitals that will hire you and start paying you before you even work, but you're obligated and you sign a contract that you have to, work for them.
Wow. So I guess my question here would be, is it very competitive in terms of, applying for these jobs?
No, honestly, I feel like there's so many hospitals, there's so many places, people always need anesthesia, so you can literally get a job. It's
That's
it's
amazing.
yeah, it's only a matter if you're being picky to where you want,
Yeah,
but
yeah,
there are jobs without a doubt.
that's amazing. Now, 7 months. So you started at a crazy time.
Oh yeah, I
So
sure did.
peak of the pandemic. So how was that?
That was nerve-wracking for me because the issue was, even with CRNAs who have been there for years, you're now being told you need to somewhat change your role and be bedside in the sense of giving orders to, certain medications you haven't probably seen in a while because, you're out of that bedside role, you're doing something else in the operating room. So I was nervous because I'm like, listen, I'm fresh. I don't really know if I can do this,
Exactly. Yeah.
and like, I've never worked night shift, even as a nurse, like, luckily, because, everyone knows as a new nurse, you're like, your first shift is night shift, but I had to do 2 nights, like one in the ER. I was dressed in a bunny suit and you're expected to help out as much as you can. And one night, I would say my worst night, that I literally was just like, mentally, if they asked me to do this again, I may quit. I had to
Mhm.
prone COVID patients, and that was draining and exhausting. And you have a list of patients you need to prone, and you walk by and you realize, wait, that patient passed away. Like, it was a lot.
So wait, so tell us, what is prone? What does that
Proning,
mean?
okay, so proning is just a fancy word for saying you turn them to lay on their stomach, because it was, when you prone someone or when someone lays on their stomach, it actually gives you better lung expansion and excursion to breathe and exchange oxygen throughout your blood. So that was like an important thing for these patients to be proned.
Okay, okay. So what happened? So sometimes you go in there and what would happen?
Sometimes you turn these patients, and like my sister had an experience, she's also CRNA. She turned the patient and they coded and they died
Oh my
because,
goodness. Oh my
COVID
goodness.
also had issues
Yeah.
with blood clots. So any little movement, you can break off a clot, and that causes a whole cascade of events. So,
Got it. Now,
yeah.
how was I guess, along with obviously everyone was being tense, did it change the role anyway? Being that it started during COVID, was there more work because of it or less work, or did you
There
have to
was
do
less
things? Okay.
there was less work, and that was why we were put in these roles, because at one point, if you guys remember, the Surgeon General said no more elective cases. So majority of our work is people coming in for hip replacement, knee, stuff like that.
Yes.
And that just had us sitting around.
Yeah.
So they saw where there was a need for nurse practitioners to help, or people to help prone, or stuff like that. So we were put in places that we weren't used to.
Yes.
So yeah.
Yes. Yes. Oh my gosh. Right. That's amazing. So now I guess you've kind of already given us a little bit of a dose of the real deal.
Mm-hmm.
But let's get into it in terms of, first and foremost, what would you have done differently?
Differently, I don't think I would have done anything differently. I feel like this job, being a CRNA, like, really lets me be very autonomous, where I'm not always, as a bedside nurse, running behind a physician to be like, hey, can I do this? Hey, can I do this? No, you're making your decisions on your own. Granted, yes, if there is, a question, or if you just need a little feedback, you can always communicate with the anesthesiologist. But when you're in your room, you're expected to manage your patient. You have the knowledge, you have the skills. So I like that autonomy, and I like, the critical care part of it, because it's not easy, managing a patient who's very sick under anesthesia. You have to understand the drugs, the body, how it works, what it's going to do. So I
Course,
think
of
it
course.
fulfills my little cup.
So I think that's a great point. So I like that you said that you do have autonomy and in the sense. Now, I guess starting off, is that does that also make you nervous because you're
Oh
not necessarily
yeah.
having someone to tell you what to do?
Yeah, it does make me, it made me nervous. It did,
Yeah.
because you're like, okay, wow. When I first started, I was like, all right, like, Sharifa, like, this is your license now.
Yes, yes, yes.
So,
So that independence comes with its own stress in a way, especially when you're just
Definitely.
starting. Yeah.
Definitely. Mhm.
Okay. Did you have any mentors along the
So,
way?
yeah, my biggest mentor is my sister. She's been a CRNA for about 12 years now. So I definitely looked up to her. She's the reason why I even know what a CRNA is.
Yes, exactly. Yeah.
You know, so any question, concern, I ask her, I talk to her, and we work together. So we definitely got each other's back.
That's
So it's been
great.
good.
That's great. So you basically had it firsthand. You had someone who was in there and kind of giving you the ins and outs, which is
Yeah,
incredible to have
yeah,
that.
definitely. It helped a lot.
That's cool. Now, what are some of the biggest misconceptions? I think we kind of touched on it a little bit because, again, we always hear about anesthesiologists. We never hear about CRNAs.
Yeah, so the biggest misconception is everyone thinks everyone's an anesthesiologist. So I feel like anyone who's in the CRNA field should make it known when you speak to your patients and you introduce yourself, let them understand who you are and what is your role, because it just advocates for us as a group and it just spreads more information and educates people that, okay, this is a profession and this is what they do.
Mhm. I guess one question I didn't ask from before is how long do you wait? Like, how long do you work? Like, what are the hours? Because one of the misconceptions in nursing is you have to work long hours.
Oh yeah. So no. With this, you have different nursing in general. There's different hours to work. The general hours that are worked are 12-hour shifts as a nurse. As a CRNA, you have different options. Me right now, I work 5/8. So Monday through Friday until 3 p.m. My sister works 2 12s and 2 8s, and she has one day off. Some people work 3 12s, some people work 3 13s, some work 2 16s and an 8. So it ranges. It's what your facility that you're working at, what they're willing to let you work, as long as you make your hours. So yeah.
Got it. So it's by the hours, pretty much.
Mm-hmm. Yeah.
Okay. And what is most challenging?
You know what? I think the most challenging part that I have encountered so far is you're the last person to talk to these patients before, and if if God forbid something goes wrong and it's not a good outcome, it weighs on you because again, some patients will be like, oh, please don't let me die. And it's just like, don't say that. Don't say that, and you're literally the last person to talk to these people, so that's probably been the most challenging part about it.
Got it. And then the crazy thing is you have no control. I mean, once you're in there, they're under, they're in surgery. It's not just really on you. There's nothing you can do.
No, you do your best. You do everything that you can, but
so emotionally, would you say that's the biggest challenge?
Yeah.
So I guess, what is the biggest reward? I guess, yeah.
The biggest reward, I feel like, okay, so when I love when my patients say, oh my gosh, like I felt nothing, or wow, it's over, and just interacting with them. And especially like when I do pediatrics with the kids, it's a scary moment. Like me as a mom, like my kids, my daughter had anesthesia twice, so I know how it feels on the other end. So I try to, talk to the moms or dads and, let them know, oh, your child is my child for the day. This is my daughter, just to make them feel a little comfortable. And so I guess the biggest reward for me is just my patients happy, taking very well care of them.
Of course. And if they feel nothing, that means you definitely did
a
good job.
Good job. That's when you say, oh, I did good anesthesia.
Exactly. Now, I know you've only been in there for 7 months, but have you noticed any changes thus far?
I would say the changes I've noticed, and I think the pandemic has definitely made it like this now, is people are realizing that time is important, like you don't have a lot of time. And, sometimes people would work relentlessly. And after this pandemic, a lot of people have transitioned out of the hospital into private like surgical centers because number one, you make a lot more money, and number two, you have more control over your hours. So I've seen that transition more in the few months that I've been in a hospital setting. A lot of people have left.
Okay, and gone into those more private settings.
Yeah.
Or independently. Okay.
Yeah.
And then the last one, I guess, is kind of goes hand in hand with that too, is there room for growth?
Yeah, there is. There's so many things you can do being an advanced practice nurse. For example, after I graduated, I took a course at Botox and dermal fillers, neuromodulators, and you can do other things. You can open up your own medical centers doing certain things. Granted, it wouldn't be anesthesia related because we can't yet be without a physician for that. But I know we didn't really touch on it a lot, but even though I'm a CRNA, I'm also an advanced practice nurse, so a nurse practitioner. So if I wanted to open up a, hydration clinic, if I wanted to do, again, Botox and fillers in my own facility, there's things you can do.
Okay. And I guess the biggest thing now would be, what would let's say someone's thinking about going into this field. What's the best piece of advice you could give them?
My best piece of advice is try to shadow a CRNA first.
Okay.
See if this is for you, because it's not an easy job.
Yeah. So I guess, is that something that you could do? Could you go in and shadow? I guess when you're in school, you could do that.
No. You can shadow. For example, I've had people shadow me. They're nurses and they're trying to decide, okay, do I want to do the CRNA route or do I want to do the nurse practitioner route? So for me, I just get the individual information and send it to my chief. And then we coordinate a day where they can come and shadow me.
Okay. And I think we have a few questions coming in. So the first one, I think, is you kind of sort of answered it. So can a CRNA work independently, like open a practice doing pain management? I think you answered that already.
Yeah. So in the state of Florida, no, we can't open our own practice and administer anesthesia. We would have to have a medical doctor over us.
Okay. All right. So it's state by state. You have to go by based off of your state. You have to know the laws. Okay.
As of right now, I know Florida, we cannot. I don't know other states if they have broken away yet, but for sure, Florida, no, not yet.
Okay. Another question. So let's say someone's a registered nurse and they've been, I guess the question here would be, should you work as a registered nurse for a while before going for CRNA? Or do you recommend working in the field first?
Honestly, so you'll notice that the requirements is like, 1 to 2 years in the intensive care unit. But it's funny, I was having this conversation with one of the clinical coordinators at a university for CRNA, and I was just like, I feel like that's a bunch of crap, because I feel like when you enter CRNA school, whether you had ICU experience or not, I just feel like you're relearning a lot. So I feel like, to me personally, I think individuals can and should be accepted into CRNA school without ICU experience. But, that's what they have it as now.
Okay. And then the last question here we have, all right, so is it a lot of downtime? So once you give someone the anesthesia, then what?
So have you guys seen those memes where you see us sitting reading newspapers?
Yes. What do you do then? After you administer, then what?
So I go and I log on to my E-Trade. I go on Coinbase. I'm joking. Honestly, it depends on the patient. If the patient is stable, sure. it's a ride. You're riding through until they're done, But if the patient is unstable, trust me, you're giving blood products, you're giving albumin, you're trying to keep their pressures up, you're giving a whole bunch of medications just to maintain that patient to survive the surgical procedure.
Got it. Now, how long are you in the surgery? I guess it's going to range, but I guess how long have you been in the surgical room having to administer?
It does range depending on the procedure. For example, like a spine procedure where your back is open and they're working on your spine, that can take you 12, 14 hours, or a cranie, which is working on your brain, that can take you forever. It just depends on the procedure.
Okay.
But again, it depends on how long you're working. So I only work 8 hours. So I'm only in there for 8 hours. And, where I work, we get breakfast break, lunch, and afternoon break. So
this job is fucking amazing. I mean, for me, I still can't get over the fact that you can actually secure a job before actually finishing, or even getting paid. I mean, to me, that's that's the biggest thing for me that I've taken away from.
You know why? A lot of the time it's because these facilities that you rotated through as a student, they already see how you work. So literally when you rotate through these hospitals, you're on a job interview. If you think you're going to want to apply there, make sure you look good.
Got it. So that's a good piece of advice. So when you're doing those rotations, you're making an impression. You're establishing yourself. That's true.
Connect with the right people. Yep. Definitely.
And then we have another question. It says, how has the COVID pandemic, has it had any impact on the CRNA job market? I think you kind of touched on that a little bit already.
I don't want to, okay. So there's still a lot of jobs, a lot. There's not like a decrease in, oh, nobody's hiring. Oh no, people are hiring.
Okay.
So it hasn't been a negative effect.
Okay, and I know you had mentioned earlier that what you're seeing too is a lot of people are going into those independent, they're leaving hospitals. Yeah, they're going
plastic surgery centers, where everybody's
more specialized.
Yeah.
Okay. All right, let's see. I don't think we have any more questions here. Let's see. All right. So thank you so much, Sharifah. We have learned so much. First of all, we learned what a nurse, an anesthetist is, right? CRNA, which I think a lot of us didn't even know what that was to begin with. And you gave us a lot of insight. And I thank everyone tonight for tuning in. Please be sure to register by going to www.studentproconnect.com or downloading our app, again, which is available in Google Play or the App Store. We will be having our new show on April 21st, so please look out for that. Thank you, everyone. Have a great night. Bye.
Bye.